The Data Collection Procedures for Forensic Skeletal Material 2.0, or DCP 2.0, contains a number of changes relative to earlier editions. So we encourage the user to please read the preface carefully for a list of these changes. We also encourage the user to please read the definitions. The manual has illustrations of some measurements, but not all, but it's very important to read the definition carefully before taking the measurement. The first measurement is maximum cranial length, or glabello-occipital length. So it's easiest to rest the skull on its base, and then to take the spreading calipers and apply one end to glabella, and then along the mid-sagittal plane to apply the other end of the caliper to the occipital region, and to move the caliper around, staying within the mid-sagittal plane until you find the maximum measurement. Okay, for nasio-occipital length, you're going to place the skull like you placed it when you were taking glabello-occipital length, and you're just going to measure from nasion anteriorly to the point in the occipital region that gives you the maximum length in the mid-sagittal plane. You'll use the spreading calipers, and remember that nasion is going to be on the frontal bone, so you'll put the caliper on nasion, one end, then you'll move the other end along the occipital region, staying in the mid-sagittal plane until you obtain the maximum length. To measure maximum cranial breadth, you can rest the skull on its base. You can also take this measurement with the skull resting on the occiput. I'm going to rest the skull on the base. I'm going to demonstrate this from this direction, and then I'll turn sideways. You're going to use the spreading calipers to take this measurement. And what you want to do is to take the calipers and place the end points, and you can start off on the parietal bone. Now, the orientation of the calipers is pretty important here. You want to make sure that the V-shape, the tip, the angle of the caliper is staying in the mid-sagittal plane. So I like to line it up with the sagittal suture. The endpoints should be within the same coronal plane. They should be lined up in this manner. So the endpoints shouldn't be off kilter in one way or the other. Okay, so you want them in the same coronal plane, then line the calipers up here in the same sagittal plane. And now you're ready to start obtaining the maximum measurement. And in order to do that, you're going to take the calipers and you're just going to move them in a circular motion. And while you're doing that, you're going to look at the slide and note where you obtain the maximum measurement, at what location. This may be on the parietal bone. If that's the case, just steer clear of the temporal lines, the inferior temporal lines. You may also find the measurement on the temporal bone. And if this is the case, you just want to steer clear of the supramastoid crest or the suprameatal crest as you're obtaining that measurement. So I'll demonstrate it from the side so you can see the areas where I'm trying to avoid. So here, if it's on the parietal bone, okay, you just want to be mindful of the temporal line, so you don't want to be up there. Okay, so you're just going to move the caliper in circles in this manner. On this particular skull, it's actually wider on the temporal. So I'm moving around the temporal now, but I want to avoid the area here, which puts me on the supramastoid or suprameatal crest. Okay, so you want to stay off of that and obtain the measurement just on the temporal bone in that manner. The next measurement is bizygomatic breadth. This measurement is taken with the skull resting on the occiput with the base facing the measurer. Now, I'm going to turn the skull towards you, the viewer, so that you can see where I'm taking the measurement. You can use sliding calipers, or you can use spreading calipers to take this measurement. That would be personal preference. I'm going to use the sliding calipers so I can demonstrate that when you do use these, that you use the blunt ends as opposed to the sharp ends of the caliper. And you're just going to place these across the zygomatic arches and then read the measuring side until you find the maximum measurement. And this measurement should be taken perpendicular to the mid-sagittal plane. And again, you want to make sure that the calipers are in the same level and not drastically off. The next measurement is Bayesian-Bregma height. For this measurement, you're going to take the skull and rest it on the occiput with the right side of the skull facing you. Now, because you're going to be using Bayesian for a number of the measurements, you might want to just take a pencil and mark a point on the skull where you're going to use for Bayesian so that you are always consistently using the same point. So with the skull resting on the occiput, you're going to hold one end of the caliper on Bayesian and then apply the other end on Bregma to obtain the measurement. The next measurement is Bayesian to Nasion, or cranial base length. And this measurement is probably most easily taken with the skull resting on the top. So you're going to just tilt the skull a little bit. You're going to take your calipers and again apply one end to Bayesian and the other to Nasion to obtain the measurement. Okay, Bayesian-Procyon length. The best thing to do for this measurement is to take the skull and flip it onto its top. You can use the spreading or sliding calipers for this measurement. It's going to depend on the degree of prognathism in the maxilla and then the presence or absence of the anterior teeth. This is not very prognathic and I'm missing the two central incisors, so I'm going to use the sliding caliper to demonstrate this measurement. Now we're going to go, I'm going to show it to you in this manner. We're going to go from the anterior procyon to Bayesian, and Bayesian in this case is not what you would consider endo-Bayesian. It's not inside of the foramen magnum, it's just on the margin of the anterior portion of the foramen magnum in the mid-sagittal plane. Okay, so I'm going to demonstrate going with the fixed end of the sliding caliper on the procyon, anterior procyon. And then I'm going to move the movable end to where Bayesian is, and I have marked that for my previous measurement. I'm just going to tilt the calipers a little bit here so that you can see where I'm at. Okay, so to take the maxilloalveolar breath from ectomolary to ectomolary, you'll turn the skull resting on its top with the face facing you. And the measurement's taken on the alveolar border of the maxilla at the level of the second maxillary molar. So I'm going to turn the skull this way so you can see me taking this measurement as you might take it. Now this particular individual has just the first and second molars, so I'm going to take the measurement there on the alveolar margin just at the level of the second maxillary molar. Now if there's reactive bone, as there sometimes is along the alveolar margin, you don't want to take the measurement there. If that's the case, you're just going to have to move the caliper a little bit superiorly and obtain it in that manner still on the maxilla. Right, so there's about where you're going to put the calipers when you're taking the maxilloalveolar breath. So the next measurement is maxilloalveolar length. And for this measurement, you're going to go from procyon to a point called alveolon. Now this point is kind of an imaginary point. You're going to need a rubber band to locate it. So you're going to take the rubber band, place one portion of it on the nasal bones. This will hold it in place. Extend it across the anterior portion of the maxilla. And then the posterior portion of the rubber band is just going to come right across the back of the alveolar process, the distal portion. Now what's important is that you don't extend the rubber band as far as the pterygoid plates of the sphenoid. Okay, so you don't want to put it there or on the hamulus or anything. You want to make sure that you're just on the distal portion, hugging the distal portion of the alveolar process of the maxilla. Okay. After you've made sure that your rubber band is in place and you have a straight line, it's not twisted, okay, then you can either use the spreading calipers or you can use sliding calipers to take this measurement. The same as with maxilloalveolar breath, it's going to depend on the degree of prognathism and the presence or absence of teeth, the anterior dentition. Since I don't have the central incisors on this particular skull, and I'm going to tilt it towards you a little bit to show you how I'm taking the measurement, I'm going to go ahead and use the sliding calipers. I've got my slide facing me, my rule, and I'm going to apply one end to prostheon, and I'm going to apply the other end in the mid-sagittal plane to the center of the rubber band. To measure biauricular breath, you're going to go from the 2 points radiculary to radiculary. It's best to set the skull on the occiput with the base facing you. So I'm going to demonstrate it this way. Now you're going to go to it's a minimum distance from right to left across the roots of the zygomatic process. This is usually found slightly anterior to the external custos meatus. You'll take the sliding calipers and use the sharp points and apply them to the roots of the zygomatic processes, the roots of the zygoma, until you get that minimum distance. And I'm going to just tilt the caliper so you can see approximately where I'm at in obtaining this measurement. The next measurement is nasion-prostheon height. To take this measurement, it'll be easiest to rest the skull on its occiput, and you can do it with the skull facing on its side. I'm going to demonstrate it for you in this manner so that you can see where I'm placing the caliper. You're going to use the sliding caliper, and you're going to place the fixed end of the caliper on nasion, remembering that you don't want to place it in the suture, in the frontal nasal suture. You want to be ever so slightly above it on the frontal bone. The movable end is then going to go to prostheon, and remember this is anterior prostheon. So if you can see, this is where I'm taking the measurement. Now past versions of the DCP have taken the measurement upper facial height, and upper facial height would be going to the inferior prostheon, okay, between the two central incisors. And that is not the measurement that we're taking here. We are going from nasion to the anterior prostheon. We're just adopting one prostheon for all of the measurements. Now, if there's resorption of the maxilla in the region of the central incisors, you can still approximate prostheon using the lateral incisor, the margin there. But if there's resorption across the entire palate, then you don't want to take the nasion-prostheon measurement. To take minimum frontal breath, or the frontotemporale to frontotemporale measurement, when you're sitting in a chair, you're just going to place the skull on its base facing you, okay, and take the measurement. Now again, since I'm trying to demonstrate this, I'm going to place the skull facing the camera to show you where to apply the ends of the caliper. So you can use a sliding caliper and just apply the sharp ends to the two frontotemporale, and this is just going to be the minimum or least distance across the frontal bone. Okay, so for upper facial breath, again, the skull is going to be resting on the base and facing you when you're sitting in a chair. But for purposes of the video, I'm going to turn the skull in this direction. And upper facial breath is taken from frontomolare temporale to frontomolare temporale. I like to use the blunt ends of the sliding caliper to take this measurement, and you're just going to go to the lateral or external edge of the frontomalar suture on the right and the left sides and obtain the measurement in that manner. To take nasal height, place the skull on its occiput with the right side facing you and use the sliding calipers. I like the pointed ends. I'm going to turn the skull a little so you can see what I'm doing. Now this measurement is going to be taken on both the right and left side of the nasal aperture, and then you're going to take the average of these two measurements to the nearest millimeter. All right, so just place one end of the caliper on nasion, okay, and then the other end, the movable end, is going to go to the inferior border of the nasal aperture on the left, and then on the right, you record each of these measurements and then take the average. In this individual, there's a very sharp nasal sill. Some skulls, of course, may not have such a sharp border. You may be dealing with a gutter, and if that's the case, just make sure that you read the definition closely so that you know where to apply the movable end of the sliding caliper. Okay, to take nasal breath, it's probably easiest to rest the skull on the occiput, all right, with the skull facing you so that you have a nice view of the nasal aperture. I'm going to turn the skull to demonstrate. Okay, so it should look something like that when you're looking at it. And this is going to be the maximum breadth of the aperture. Normally this is found lower in the nasal aperture. Use the sliding caliper, and you want to be pretty precise, so I use the pointed edges of the caliper. Just be careful with the delicate nasal bones, and just place the pointed edges. Again, I'm doing this upside down, so please don't take this as perfection, but place the pointed edges right along, place the points right along the edges of the nasal aperture at its widest point. All right, to take orbital breath, place the skull on its occiput with the orbits facing you. For standardization, we take the left orbit, but if some of the landmarks are damaged or not present, you can use the right orbit. In this particular skull, dacryon is damaged in the left orbit, so I'm going to demonstrate it on the right orbit. So you're going to find 2 points, dacryon and ectoconchion. And please refer carefully to the cranial landmark definitions to find these 2 landmarks appropriately. But just briefly, ectoconchion is going to be on the anterior border of the lateral orbit. And so you want to make sure that you're anterior. One way of doing this is to take a pencil and just rub the orbit, right? And you'll delineate the anterior margin. From there, you can use a wooden dowel. Make sure you keep it parallel to the superior orbital margin, and then just move down until you bisect the orbit into 2 equal halves. So this may not mean that you're perfectly straight, right? Your dowel may seem kind of tilted. And then take a pencil and mark ectoconchion on that anterior border. Dacryon can have variable expressions, so again, refer carefully to the definition, but just recall that when you're marking dacryon, it is on the frontal bone. And I'm using here the tip of the lacrimal fossa, and then I've got my frontomaxillary and frontolacrimal suture here, and I'm going to mark dacryon there on the frontal. And then from there, you're just going to use the sliding calipers, okay, and you'll put the pointed ends, and you'll put one tip on dacryon, and then extend the other to ectoconchion on the anterior border of the lateral orbit. Orbital height is measured perpendicular to orbital breadth. So if orbital breadth is measured in approximately this location here, right, then orbital height is just going to be perpendicular. You're going to use the sliding calipers again. Now if you have sliding calipers that have these kind of inside jaws to allow you to take an inside measurement, They are ideal, and you can just go from the superior to the inferior orbital margin and take the measurement in that manner. Just make sure that you're perpendicular to the orbital breadth measurement. If you don't have calipers with jaws like that, okay, just make sure that when you take it, that you're very careful in applying the sharp edges, okay, along the superior and inferior orbital margins. Avoid any foramina or anything like that because it is more of an inside measurement right along the edge there. Okay, biorbital breadth is the measurement from one ectoconchion to the other. So you're going to have to mark your ectoconchion on the other side, which I've already done. Take the sliding calipers and just apply the the sharp points of the caliper to the ectoconchion, again located on the anterior margin of the lateral orbit. Inner orbital breadth is measured from right to left dacryon. Again, remember the dacryon is going to be on the frontal bone, and read the landmarks carefully to make sure you can locate that. I mentioned that the left dacryon on this particular skull was damaged and a little bit difficult to find, but I have been able to locate it. And so I'm just going to take the sliding calipers, the blunt ends, and apply from one dacryon to the other. And I'm sorry, I said blunt ends, and I'm using the sharp ends. From one dacryon to the other to get the inner orbital breadth. All right, the next measurement is frontal chord. This is the straight line distance between nasion and bregma. I like to place the skull on the occiput slightly. I like the left side of the skull facing me. That's probably personal preference. Using the sliding caliper with the pointed tips, place one end on nasion. Remember that's on the frontal, don't dip into the suture, and the same goes for bregma on the frontal to get the frontal chord. Now the next measurement is going to be parietal chord. So that's going to be from bregma to lambda. So you can just take the skull and shift it, and if you can see lambda, which I can here, then you're just going to go from bregma, as you found it, to lambda. And remember that this is taken in the mid-sagittal plane. Now, if you can't locate lambda or bregma because of cranial sutures being obliterated, then you'll need a pencil to make sure to be able to trace sutures, right, and find the point where they intersect in order to locate lambda. So just refer to the cranial landmarks definitions in cases where you can't locate lambda or bregma because of the obliteration of the cranial sutures. And now for occipital chord, you're going to want to flip the skull over, right? Rest it on the top. And you're going to go from lambda, as you previously located it, to opistheon. And opistheon is going to be on the inner portion of the posterior margin of the foramen magnum. So just take your sliding calipers, right? Apply the pointed end, and right, go from lambda to opistheon. And I'll show you in this direction here how I'm doing opistheon. So I'm going from lambda to opistheon on the inner margin of the foramen magnum. Okay, the next two measurements are measurements of the foramen magnum. So we're going to take a length and a breadth measurement here. And foramen magnum length, so you can leave the skull in the same position that you had it when you took occipital chord. And for foramen magnum length, You may want to tilt it towards you a little bit. I'm going to demonstrate it like so. You're going to use the inner jaws. This is where it's good to have the inner jaws of the sliding calipers to take this measurement. Okay, so it's going to go from a piston, as you found it when you were taking occipital cord, to the anterior border of the foramen magnum, using the inner jaws. And then for foramen magnum breadth, this will be a perpendicular to measurement. You're just going to go to the greatest lateral expansion of the foramen magnum. And again, use the inside jaws of the calipers to take this measurement. The mastoid height, you're going to take the right and left side. This measurement is going to be taken from porion at the upper margin of the external acoustic meatus, to mastoid alley, which is the distal tip of the mastoid process. So you just want to make sure that the caliper comes into contact with porion superiorly, and then mastoid alley, the distal portion, inferiorly. Biastereonic breadth, the straight line distance between left and right asterion. To take this measurement, I like to set the skull on the top, all right, and just it's where I can visibly see both asterions. All right, so you can see here that you can see one asterion in the other, and just take sliding calipers, right, and go from asterion to asterion. The next two measurements are taken on the face. We're going to first take bimaxillary breadth. All right, so to take this, rest the skull on the occiput, face towards you, and use the sliding calipers with the pointed ends. Bimaxillary breadth is taken from the inferior portion of the zygomaticomaxillary suture on one side to the same point on the other. And when you take this measurement, just make sure that you're not taking it on the inferior margin, but rather anterior margin of that suture. Okay, so I like to just take the calipers and place them from one suture to the next on that anterior portion of the bone and take the measurement like so. The next measurement is going to be zygoorbitale breadth, so from left to right zygoorbitale. Okay, and this is going to be the superior portion of the zygomaticomaxillary suture where it intersects with the inferior orbital margin. So just use the pointed tips of the caliper and place it on one zygoorbitale, and then place the movable tip on the other to obtain the measurement. Okay, for mandibular measurements, you're going to need sliding calipers and a mandibulometer. The first measurement is chin height. Chin height is going to be taken from infradentale between the central incisors to gnathion. Okay, and we're going to take this measurement like so. Now, if the alveolar border between the central incisors is damaged, you can use the same position, approximate it between the lateral incisors. If you do this, just make sure that you indicate it on the recording form. And if there is significant resorption of the alveolar process, then this measurement shouldn't be recorded. Height of the mandibular body is taken at the level of the mental foramen, and I'm going to indicate that here. This would be the mental foramen. It's not as visible here on the left side which is the side I'm going to take the measurement on, but there is the middle foramen. You're just going to take the sliding calipers and go from the alveolar process to the inferior border of the mandible. The breadth of the mandibular body is also taken at the level of the middle foramen. To take this measurement, you can flip the mandible over and use the blunt ends of the sliding caliper and apply them to the mandibular body, all right, in order to obtain the breadth. Okay, to take bigonial breadth from one gonion to the next, I set the mandible on the surface, okay, with the chin facing me. So I'll do that for you. And then I use the blunt ends of the sliding caliper, and I use them almost like an osteometric board to just go between the two gonia and obtain the measurement in that manner. This is especially easy and useful for gonia that are particularly flared. Okay, bicondylar breadth, the distance between the two condylons. So for this measurement, again, mandible resting, chin facing you. So I'll turn this way for you. Using the blunt ends of the sliding caliper, just apply it to the two landmarks and obtain the measurement in that manner. To take minimum ramus breadth, you're going to hold the mandible, the left side facing you, and you're going to take this measurement at what we call the waist of the mandibular ramus. This is because this is a minimum measurement. You want it at the most in-pinched area of the ramus. Okay, so I'm holding this towards you as I would hold it towards myself when I'm obtaining that measurement. Okay, the next three measurements should only be taken if you have a mandibulometer. And this is going to be ramus height, mandibular length, and then mandibular angle. So to sit the mandible in the mandibulometer, and the first thing I do is to slide the kind of horizontal portion backwards. Okay. And you want to make sure the mandible just stays in contact with the bottom portion, the bottom plate. Okay. And right now I'm just kind of moving the upper bar onto the condyles, resting on the condyle, and I'm making sure that the back portion, this back plate, is in contact with the posterior portion of the ramus. Okay, and once you get that all situated, okay, then you just read the three measurements. So you read the ramus height, the mandibular length, and then the mandibular angle. Okay, to take the postcranial measurements, you'll need an osteometric board. This particular osteometric board has a hole to take some of the tibial measurements. You'll also need a set of sliding calipers and a set of spreading calipers. And you'll need a tape measure and a pencil. Okay, the first measurement of the postcranium is the maximum length of the clavicle. Now, this clavicle has an epiphysis fusing to the medial end. So when that's the case, you can take the measurement, but go ahead and note that there is the presence of an epiphysis. So to take the maximum length, just place the clavicle within the osteometric board, okay, and bring the movable end, okay, to the lateral end of the clavicle. And then you're going to wiggle the clavicle a little bit, and the side to side and up to down to make sure that you have the maximum measurement. After you've obtained the maximum measurement and recorded it, use a pencil to estimate the mid-shaft of the clavicle, mark it with the pencil, and then the next two measurements will be done with the sliding caliper. You're going to measure the maximum and minimum diameter of the mid-shaft of the clavicle. And so to do this, all right, you'll take the sliding caliper and place it in the location of the pencil mark, and then you're going to turn the calipers until you obtain the maximum measurement. And then you'll do the same to get the minimum measurement at mid-shaft. Okay, so to obtain the scapular height, you can use sliding calipers if the scapula is from a small female, for example, and you can spread the calipers, and in this case I use the blunt end of the calipers. So this individual is relatively small, and I can spread the calipers far enough to obtain the measurement. I'll show you of the height of the scapula. So in very large individuals, that's not possible, so you'll have to use the osteometric board to obtain the scapular height measurement. To take scapular breadth, what you'll do is you can use sliding calipers. You can also use spreading calipers. I'm going to demonstrate with the sliding calipers. Okay, and you're going to go from the midline of the dorsal border of the glenoid fossa, or the midpoint. Okay, and then you'll take the fixed point of the caliper will go there on the glenoid fossa, and then take the movable end and bring it to the medial border of the scapula, just along the level of the scapular spine. The next two measurements are of the glenoid fossa. These are two new measurements. You're going to take the glenoid cavity breadth and height. So the breadth is a maximum breadth of the glenoid fossa. And these two measurements are going to be perpendicular to one another, okay? And so you'll take the height perpendicular to the breadth and vice versa using the sliding calipers. Now, if you've got severe lipping along the glenoid fossa, then you shouldn't take these measurements. Okay, so for the measurements of the bones of the upper limb, you're going to put the proximal portion of the limb bone against the fixed end plate of the osteometric board, and then the distal end of the bone will go against the movable end plate. Now for the humerus, the first measurement is maximum length of the humerus. In order to obtain this measurement, you're going to move the bone side to side and up and down to get the maximum measurement. Once you've obtained that measurement, determine the midpoint of the bone, okay, using the scale, mark it with a pencil, and then use sliding calipers. Use sliding calipers to take the maximum and minimum midshaft diameters. Okay, in maximum and minimum diameters, okay, you're going to rotate the bone to obtain the maximum. Okay, and then you're going to ensure the same that you have the minimum measurement. To measure the epicondylar breadth of the humerus, this is a distal humeral measurement. You can use either sliding calipers or the osteometric board. If you use the sliding calipers, you'll want to use the blunt tips of the caliper to take this measurement. I prefer to use the osteometric board, okay? And when you do this, notice I have this rule here, so I would actually take the measurement if I were standing on this side, like so. Okay, to measure the vertical head diameter of the humerus, it is just a measurement from the superior to inferior border of the head. And use the sliding calipers. You can orient these like so when you take the measurement. I like to use the blunt end of the caliper. Or you can orient the calipers in this manner to obtain that measurement. Okay, the measurements of the radius. Okay, so put the proximal end of the bone against the fixed end plate or end board, distal end against the distal end board to obtain the maximum length of the radius. And again, here you're going to want to move the bone sideways and up and down to get the maximum length. Once you've obtained the maximum length, take a pencil and mark the point where you determine the mid shaft to be. Okay, and then you'll use sliding calipers to take the maximum and minimum diameters at mid shaft of the radius. And as with the other maximum and minimum diameters, you're going to have to move the bone around a little bit in order to determine what the maximum is. Okay, and then the next measurement would be the minimum. And make sure you move it around to ensure that you've obtained the minimum. The last measurement of the radius is the maximum diameter of the radial head. You'll use sliding calipers for this measurement. You can use the blunt or sharp ends to measure it, depending on how how the radial head is. I'm going to use the blunt ends here, and you're just going to take the calipers, apply them to the lateral sides of the radial head on the articular surface, the lateral portion, and then just turn or rotate the radius until you obtain the maximum measurement. Okay, so to measure the ulna, place the proximal end against the fixed board. The distal end will be against the movable board. And to obtain the maximum length, you're going to wiggle the ulna up, down, and sideways. After you've recorded that measurement, determine the midpoint and mark it with a pencil. And then use a set of sliding calipers. You can use the blunt or sharp ends to determine the maximum diameter and the minimum diameter at midshaft. Okay, so the next measurement is physiological length of the ulna. And I'm going to go over the points that you use to take this measurement before showing you how to take it. So you're going to want to look at the olecranon fossa of the ulna. Okay, and the measurement is taken along the guiding ridge. Now, the guiding ridge will be the midline, marks the midline between the medial and lateral articular portions of the coronoid fossa. Okay, and the measurement will be taken along the guiding ridge, along the articular surface of the coronoid process. Okay, so you'll go deepest portion of that articular surface on the guiding ridge. That's the proximal point for the measurement. The distal point is going to be the most distal portion or distal point of the distal articular surface of the ulna. So you don't want to take it on the styloid process or in the fossa between the distal articular surface and the styloid process. You want to make sure that you're on the distal articular surface. Okay. It's a good idea when you're taking this measurement, if you hold both ends of the spreading caliper, it gives you a little more control over where they're placed on the bone to get the measurement. To take the minimum circumference of the ulna, We're taking this on the distal portion of the ulnar shaft, okay, just proximal to the articular surface. And you're going to need a tape to take this measurement. You're just going to wrap the tape and obtain the minimum at this distal portion, and then take your reading on the tape. Okay, the next one is going to be the breadth of the olecranon process. This is the maximum breadth, and you're going to take the measurement perpendicular to the long axis of the bone. So use the sliding calipers to orient them perpendicular to that axis, okay, and then obtain the maximum measurement. And you can see here that I'm using the blunt ends, and I just find it much easier to use the blunt ends to obtain this measurement. The next measurements are going to be the measurements of the sacrum. The first one is anterior sacral height. In order to take this measurement, it is a mid-sagittal measurement, and you're going to place the pointed end of the sliding caliper on the promontory of the sacrum, and then slide the movable end right down to the corresponding point on the distal tip of the sacrum. And you want that on the anterior border. I'll try to demonstrate that here. Now, if the sacrum has more than 5 segments, then count the segments and note them on your sheet. And if the coccyx is fused to the sacrum, do not include it in the measurement. Okay, so to take the anterior breadth of the sacrum, you need to find the most anterior projection of the auricular surface. So to do that, you might hold the bone sideways so that you can find that anterior projection. The measurement is taken from one side to the other, and it's taken, okay, anteriorly. This is the anterior breadth. Okay, so in this manner, and for example, not along the lateral portions of the bone. Okay, so you want to make sure that you get it at the point of the most anterior projection of the auricular surface, okay, and that you take it as an anterior measurement and not a lateral measurement. Okay, the next 2 measurements are going to be taken on the proximal articular surface of the sacrum. Okay, so the transverse diameter of the first sacral segment would be measured from the lateral margins of the first sacral segment. Now, what's important is that they are taken on the sacral segment and not to the sides. And if there's lipping, as you can see in this individual here, then you want to approximate the natural articular surface with your calipers and not include the lipping in the measurement. The next measurement is taken perpendicular to that measurement, and this is the AP diameter of S1, and that measurement is simply going to be the anterior to posterior measurement. Typically, there's not a lot of lipping in this dimension, but if there is, again, you don't want to include that in your measurement. All right, so the first of the pelvic measurements is maximum innominate height. To take this measurement, I like to use an osteometric board. And you'll place the ischium against the fixed upright and take the movable upright and move it to the ilium, and then you'll kind of move the ilium up, down, and sideways until you get the maximum reading. You're on. To take the maximum iliac breadth, you can set the bone on a surface. I've just set it on my osteometric board here, and use spreading calipers. And you want to go from the anterior superior iliac spine to the posterior superior iliac spine, making sure to obtain the maximum breadth of the ilium. Okay, to measure the minimum iliac breadth, you're going to look for the area just distal to the anterior inferior iliac spine. It's an area of incurvature. And you're going to measure to the greatest incurvature of the sciatic notch. Okay, so I like to use the spreading calipers for this, though you could use sliding, and place one end on the sciatic notch, the other in the region below the AIIS, and make sure that you're obtaining a minimum measurement. Okay, the next measurement is going to be the maximum pubis length. This is going to be from symphysion, which is the most superior point on the pubic symphysis, and it's going to go to the most lateral portion of the acetabulum on the acetabular rim. Okay, so you want to make sure that you're not going to inside or outside of the rim, especially in this individual because we have some pathology along the rim. Okay, so I'm going to take the caliper and I'm going to place it in the location of the rim there. I'm going to use sliding calipers, and I'm going to measure from, I'm doing this upside down to show you, but from symphysion to, okay, that most lateral portion of the acetabular border. To measure minimum pubis length, you're going to go from symphysion, the superior point on the pubic symphysis, to the portion of the acetabular rim that is closest to that point. I'm sorry, that's going to be here. All right, so you're going to take your calipers, sliding calipers, and go from symphysion to the acetabular rim on the rim, making sure that you get the minimum measurement, minimum pubis length. To take the measurement ischial length, you're going to want to be able to discern the medial portion of the ischial epiphysis. And it's difficult in individuals that are older or have pathology. So for example, in the bone I was using a moment ago, you can see that it'd be difficult to determine that point on this bone. You know, it probably be located right around there. If you can't discern where this is on the bone, then you should not take this measurement. I'm going to go ahead and show you where you would take the measurement on this one, and I'm going to use this point here, okay, as the medial extension of the ischial epiphysis. And then the other point that you're going to use for this measurement is the point on the acetabular rim where the acetabulum intersects the ilium. Okay, so it's right where the iliac blade meets the acetabulum, and that's the point on the acetabulum that you're going to use for the measurement. So just take the sliding calipers and put it on that point on the acetabulum and extend down to the medial extension of the ischial epiphysis to get the ischial length. All right, to take the minimum ischial length, you're going to go again from that medial portion of the epiphysis on the ischium here and measure to the closest point on the acetabular rim from that point. All right, so again, just using the sliding calipers, I'm going to take them and go from the medial extension of the ischial epiphysis. I'm going to measure to the closest point on the acetabulum and obtain a minimum measurement. Okay, the next one is the maximum ischiopubic ramus length. So this is the ischiopubic ramus here. You're going to go from the inferior point of the pubic symphysis, okay, to the most distal part of the ischial tuberosity to make sure that this is a maximum length. So I find it easiest to just rest the bone kind of against myself and apply the blunt end of the caliper to the inferior portion of the pubic symphysis, and then the other end to the ischial tuberosity until I get a maximum measurement. Okay, to measure the anterior superior iliac spine to symphysion measurement, remember symphysion, the superior portion of the pubic symphysis, just take some sliding calipers, hold the pubic bone in one hand, apply one tip of the sliding caliper to symphysion, and then extend the other tip to the anterior superior iliac spine. Okay, the next measurement is taken between the posterior superior iliac spine and symphysion. This is a maximum measurement. Depending on the size of your individual, you can use the spreading calipers, but for this individual you could use sliding calipers, but for this individual I'm going to use the spreading calipers. And I'm going to place one end on symphysion and then the other on the posterior superior iliac spine to ensure that I get the maximum measurement between those 2 points. All right, the last pelvic measurement will go from symphysion on the pubic symphysis to the apex of the auricular surface. This is a minimum measurement from the apical border to symphysion. For this measurement, it's easiest to use the sliding calipers and just to place one end of the caliper on symphysion and the other on the apex of the auricular surface. Okay, so to take the maximum length of the femur, you're going to place the distal portion of the bone against the fixed end plate, and you're going to move the movable end plate to the proximal portion of the bone. Now, this is a maximum measurement, so you're going to take the bone and you're going to move it sideways, up and down to make sure that you get the maximum reading. Now at this point I like to mark the midshaft for my midshaft measurements. I'm just using a pencil. The next measurement is bicondylar length of the femur. When you're taking bicondylar length, you want to make sure that both of the distal condyles of the femur are in contact with the fixed end plate of the osteometric board. And once you've done that, then you'll just slide the movable end plate to the head of the femur and then take the measurement. All right, so to take the epicondylar breadth of the femur, you're going to rest the bone on the osteometric board, and you want to make sure the medial and lateral condyles are both resting on the board. Okay, and then you're going to move one condyle up against the fixed end plate. You're going to slide the movable end plate against the other condyle and take the measurement. To measure the maximum diameter of the femoral head, you're going to use the sliding calipers. And for this measurement, I like to use the blunt ends of the caliper, and you'll just take the femoral head between the ends of the caliper, and then you're going to rotate the caliper in order to find the maximum measurement. Now it's important that you don't slide down onto the neck or too far up onto the articular surface. You want to be along the edge of the articular border of the femoral head. Okay, so the next two measurements are the subtrochanteric measurements. And these measurements, it's very important that you try and take them as consistently as possible because they are prone to a relatively high amount of observer error. In order to determine where to take the measurement on the femoral shaft, of course they're subtrochanteric, so you're going to look at the lesser trochanter and move distally. The next thing you want to do is determine the point of greatest lateral expansion of the femoral shaft, just distal to the trochanter. Now in this particular bone, I'm determining that region to be approximately right here. All right, and so I'm actually going to take a pencil and mark this area because I'm going to take two measurements around here, and so this will help me when I flip the bone for the AP measurement. Now if you're dealing with a bone where the femoral shaft is relatively parallel up and down and it doesn't flare, then you'll want to take the measurement in a region that is 2 to 5 centimeters in distal to the lesser trochanter. You're going to take the transverse diameter in a plane that's parallel to the anterior surface of the femoral neck. So you'll want to make sure that you can orient that plane, turn the bone towards you, take your calipers, and then take the measurement, which goes from the medial to lateral borders of the shaft, and orient the calipers to where you can make it parallel to that plane defined by the anterior surface of the femoral neck. The AP measurement at the subtrochanteric diameter, all right, is going to be taken perpendicular to the transverse measurement. So I've already marked the mid-shaft of the femur. I'm just going to take the sliding calipers to take the maximum and minimum mid-shaft diameters. Okay, and as with all other maximum and minimum mid-shaft diameters, okay, you're just going to rotate the bone in the calipers or rotate the calipers around the bone to determine that measurement. And then also do the same to make sure that you have the minimum measurement. The next measurement is a circumference at mid-shaft, and you'll use the tape, okay, to take that measurement, and you'll find that region where the 0 point of your tape, okay, intersects the actual dimension on the tape. The next two measurements are measurements of the medial and lateral condyles. They're going to be anterior-posterior measurements. You'll do them with the sliding caliper. The blunt end is preferable. So you'll take the anterior-posterior diameter of the lateral condyle, and then you'll do the same measurement on the medial condyle. The first measurement of the tibia is tibial length, and we would call this the condylomalleolar length. It's going to go from the lateral condyle to the medial malleolus. Now this osteometric board has a hole where you can place the intercondylar eminences so that the lateral condyle is in contact with the fixed end plate of the osteometric board. So you can do that, making sure that the posterior surface of the shaft is facing the osteometric board, and then move the movable end plate to contact the medial malleolus and obtain your measurement. Now, if your board doesn't have a hole into which you can place the intercondylar eminences, then you're going to want to measure from the lateral condyle to the medial malleolus, keeping the tibia as parallel to the long axis of the osteometric board as possible. And the best way to do that with this particular tibia is going to be to place the lateral condyle against this portion of the osteometric board, and then to come in with the movable end plate until it contacts the medial malleolus. Again, you just want to make sure that the bone is not oriented in too much of an angle, that it's as parallel to the long axis of the board as possible. Now, once you've obtained that measurement, you'll want to go ahead and just mark the midshaft because you'll be taking some midshaft measurements in just a minute. To measure the proximal epiphyseal breadth of the tibia, okay, again, you're going to place the tibia on the osteometric board with the posterior surface on the board. Okay, one side in contact with the fixed end plate, and then move the movable end plate to get the measurement. To take the distal epiphyseal breadth, okay, we'll do the same thing by placing the distal end of the tibia on the osteometric board, and you want the two lateral protrusions of the distal tibia, that distal epiphysis, you want those in contact with the osteometric board, so both in contact with the osteometric board, and then from there you simply slide the movable end plate to contact the medial malleolus and get the measurement. Note that you're not going to wiggle this in any way. This is not a maximum measurement. To obtain the midshaft diameters, I've already marked the midshaft of the bone with a pencil. So you're just going to take the sliding calipers, you can use blunt or sharp ends, and you'll rotate the bone in your hand or rotate the calipers until you locate the maximum diameter. And then you'll want to make sure that you have the minimum diameter in the same manner. The next measurement is the circumference at midshaft. And for this, you're going to use the tape and take it similar to the way you did the circumference of the femur at midshaft. All right, to take the maximum length of the fibula, just place the distal end of the fibula against the fixed end plate. Move the movable end plate to contact the proximal end, and then just wiggle the bone side to side, up and down, until you obtain the maximum measurement. Now at that point, you'll want to mark the midshaft, and then use sliding calipers, rotating the bone in the calipers until you locate the maximum midshaft diameter. So to measure the maximum length of the calcaneus, you can use sliding calipers or the osteometric board. I'll demonstrate with both. If you're using sliding calipers, just place the calipers, I like to use the blunt end, on the posterior portion of the calcaneus at the tuberosity, and then I bring the movable end to the anterior articular surface for the cuboid and get that maximum measurement in that manner. If you're doing it on the osteometric board, again, you're just using the board and sliding it against both of the same points. Now, if the calcaneus has excessive heel spurs, then you don't want to include these in this measurement. Okay, to take the middle breadth of the calcaneus, you're going to want to measure from the most lateral projection of the posterior articular facet to the most medial portion of the sustentaculum tali.